Thank you, Board of Directors, for allowing us this opportunity of presenting to you all this brief presentation. This presentation is made possible by our Chief Executive Officer of Chaparral Regional Hospital and her wonderful team. This presentation seeks to highlight the pros and cons for quality improvement in healthcare, in hope to further highlight the need for this tool and program within our healthcare organization. Before we dive into the meat of the subject, it will be imperative that we identify what is quality improvement, QI as some affectionately calls it, and differentiate it from the associated name, which is quality assurance, QA. What is quality improvement? Quality improvement is considered to be both retrospective and prospective, mostly prospective, meaning it seeks to make or build upon improvements, seeks to avoid errors and waste, and attempt to limit or avoid accusations. Quality assurance, on the other hand, is considered to be retrospective, meaning looking back and dealing with past events or situations, quite often punitive. Trying to find out who was at fault usually becomes the target mission. The definition of quality improvement really depends upon the stakeholders. Who are they, you might ask? They are physicians, patients, employees, employers, government agencies, and insurance companies, payers. Let us take a closer examine of what each stakeholders consider quality in healthcare. For the physicians, they are continuously seeking to ensure that diagnosis of patients are appropriate and treatment of diagnosis are adequately conducted, ensuring faster recovery for its patients. For patients, they desire to have the most experienced medical personnel overseeing his or her care, engage with those that brings compassion and empathy, and display an effectiveness in communication. For employees, these groups want to be equipped with the right tool for success, great benefits, and strong sense of belonging. For the employers, they're continuing to examine ways to keep costs under control and getting the right team in place that are specialized and equipped to function in their respective field. For government regulatory agencies, they're continuously ensuring that patients' rights are adhered to, uphold standards of care, and enforce ethical conducts according to the law. For your insurance companies, the payers, they examine ways to keep costs effectively low while ensuring that costs associated with their clients are appropriately necessary. Here are some historical facts of quality improvement. Quality improvement theory and techniques that we use today was put forward by Deming and Jurin. During the 1980s, Japanese auto manufacturers put this method to the test using their method. By the 1990s, US manufacturers decided to adopt this theory, including the healthcare sector, after taking notice of the Japanese industry's rapid growth of development. A brief history on Deming. Deming taught Japanese engineering top management, statistical methods, and how to view production has a system that includes suppliers and consumers, while Duran delivered lectures in Japan about managing for quality. In comparison to other regions of the world, the US felt that we were at a disadvantage in retrospect to the rising cost of healthcare expenses. This included products, employee benefits, and patient care costs. Therefore, US healthcare executive and administrators developed what we call total quality management technique. This allowed healthcare organizations to closely examine numbers of issues: medical errors, needless procedures, preventable morbidity and mortality rate, and employees' work-related injuries. Let's take a look at some benefits of quality improvement. First, it simplifies the process. Continuously seeking to simplify process, avoid chaos and departmental interference. Secondly, it enhances effectiveness of desired outcome. When quality improvement is initiated, it is considered that we are seeking a desired outcome and establish a time frame to accomplish our goals. For example, if the goal is to reduce our emergency room waiting time, then that becomes our target. The follow-up question we should then ask ourselves are, by when should we get this goal? An outcome should then follow is eliminating methods of redundancy. By eliminating methods of redundancies, not also help our facility operate efficiently, but it also eliminates supply waste and unnecessary time. Fourth, promote creative thinking. Promote creative thinking encourages us to think outside of the box, continuously seeking to make improvement in every facet of the workplace. Other benefits of quality improvement are cost control. It encourages us to focus on the team engagement, and it provides useful data for us to use. When it comes to cost control, let's examine two areas of concerns. One are patient costs, and the other is operational costs. As it relates to patient costs in healthcare, as a new technology is introduced, so does the rising cost of healthcare, and people are also living longer. So how do we improve upon our clients' health while keeping the fees associated at a manageable cost becomes a challenge? Operational costs. For a healthcare organization to thrive in a competitive market, whereas each hospital wants to demonstrate the latest breakthrough in medicine or have the most experienced doctors, quality improvement offers us a great opportunity to assess our organization by examining what are the needs of the communities we serve. What are the waiting times to see a doctor or get consultation to see one? Do all of this while staying cost effective for our stakeholders are essential. When it comes to focus on the team engagement, quality improvement offers us. Team engagement is not only boost morale, but it gives everyone a sense of belonging, a feeling that their voice are heard. When it comes to provide useful data, okay, providing useful data gives us a concrete foundation, whereas we can be confident about implementing a quality improvement method without a sense that it will fail. Other benefits of quality improvements are it provides and encourages continuity of care. It promotes method for reducing medical errors, and it also promotes timely treatment of care for its patients. Okay, there's a lot to digest here. When it comes to encourages is continuity of care, when we ask our patient what matters to them the most, what we will gather is that they want a continuity of care from one provider to the other, depending on his or her health condition. Quality improvement offers us the ability to explore meaningful ways we can make this possible. For instance, if a patient visits the emergency room and then given instructions to follow up with their doctors after discharge, and this provider happens to be within our network, then he or she should be able to access their patient record easily. Electronic medical record is one way of providing us that information. When it comes to promoting method for reducing medical error, quality improvement offers us a continued opportunity to examine methods for reducing medical errors. This can sometimes be caused by longer waiting times in the hospital, inadequate treating of the cause or symptom, fewer clinical breaks, longer hours, improper documentation, and misdiagnosis of the root cause. In the US, according to a report published in 1999 by the Institute of Medicine, it indicated that as many as 98,000 Americans were dying annually because of medical errors. Estimates of annual patients' death due to medical errors have since risen steadily to 440,000 lives, which will make errors the country's third leading cause of death. Let us examine some cons of quality improvement. Some of them are not having the right team, lack of company-wide commitment, lack of data to support findings, time consuming for employees to serve on quality improvement committee. By not having the correct team identified to carry out the quality improvement method, it will become a recipe for disaster. For example, if we would like to identify how long it will take to discharge patients in the emergency room and implement a targeted time frame, then it is with hope that we would not include an electrician in this study, simply because he or she is only experienced to talk or give suggestions when it comes to electricity and not patient care. Quite often, quality improvements are difficult and it requires a company-wide commitment. Everyone must be committed to the program to succeed. In not doing so, will undermine its purpose. When it comes to insufficient data to confirm or support a quality improvement measure is likely to fail upon implementation, simply because it is necessary that we scientifically support our findings. This will tell us whether it works or not, before we make it a company-wide implementation. Sometimes serving on a quality improvement committee can take away focus and time away from employee day-to-day operation. Example, checking in on patients. As we conclude, let us identify the issues and offer innovative solutions. By identifying the issues and challenges in which we continually faces within the healthcare, it will only allow us to make improvement, keeping all our stakeholders engaged throughout the process. When it comes to improve the quality of the healthcare in America, when we mention healthcare quality, what we should ask ourselves are, is it my responsibility? Without going much further to seek the answer, ultimately, we will find out that it is all of us responsibility. Another thing I would say in concluding is stay connected to the goal for quality improvement. We are as weak as the next link if we do not commit ourselves to quality improvement within our organization. Therefore, I task everyone, let us make it meaningful and committed to finding improvements.